I'm Alex Stone, former military service member and law enforcement officer, now CEO of Echelon Protective Services, one of the fastest growing private security firms on the West Coast. And this is Ride Along, where our guest and I witness firsthand the issues affecting our community. I believe our proven method of enacting meaningful change through compassion and understanding is the best way to make our streets a safer place and truly achieve security through community.
Hi, my name is Tiffany Hammer, and I'm an advocate here in Portland, Oregon, and I spend most of my time making real connections for our folks on the street. I'm here today to do a ride along and show you what we do behind the scenes.
Hey, I'm Alex Stone. This is The Ride Along. Today's guest is Tiffany Hammer, formerly a registered nurse about to get her certification back. She's currently a consultant for Loving One Another, which is our nonprofit that kind of works with us on the streets. She's really the nervous system behind everything we do, and she is literally the cherry on top. She makes everything successful for us on the streets. Tiffany, kind of explain who you are, give us a little bit about yourself.
Great. Thanks, Alex. Thanks for having me. As he mentioned, my name is Tiffany Hammer, and I've been in Portland a little over 23 years. I'm an Oregonian native, and I came to Portland for my bachelor's in science and nursing here at the Good Samaritan Hospital in Northwest, and I've never left. And this is
You fell in love with Portland.
I did.
The old Portland.
Yes, the old Portland. And I'm also committed to the new Portland as well. But for today, yes, I am in the process of reinstating my nursing license with the state of Oregon, and I'm almost there this month. My specialty was trauma nursing, and my subspecialty was community health nursing. And back in my heyday, I taught mental health nursing at our nearby hospitals as well as Unity. And so one of the things that...
And what is Unity?
Unity is behavioral health. Yeah. It's a hospital here in Portland, and it's actually, we used to, back in the day, have Portland, Oregon State Hospital, and that's where I also taught mental health nursing as well. As we all see in our crisis right now, Oregon is struggling with mental health beds. It starts at the state level, like Salem for the Oregon State Hospital, as well as Portland, which it had POSH. And then we went through this whole transition after I was teaching to downsize, and POSH essentially went away and is now Unity. And Unity's been struggling for beds, but...
in fact, in Oregon, I think we're 48th out of 50 for total hospital beds per capita in the nation.
I don't know what the current figures are, but you're right. We're struggling, and it's really hard for Oregon because we have the largest amount of crisis in terms of mental health and drug use addiction, and we're the 48th to dead last for services. So we need to do something different. And then you probably saw recently too, I think there was a lawsuit with the state of Oregon on the emergency room beds and the inability to provide that care out on the street. And so we're actually seeing the fallout of that as we speak on the streets.
So with a background in nursing, specifically trauma nursing, so I'm assuming you spent a lot of time in the ER, right?
My senior practicum was the ER and also trauma, surgery.
So you're seeing a lot of violent type of injuries, right?
Yeah.
You're experiencing a lot of mental health issues because
Correct.
obviously that's where people end up taking.
Correct.
Have you ever experienced a police officer dropping somebody off on a police officer hold?
I've done gunshot wounds on cases, and I've seen families that were struggling, with the violence on the streets. I've also seen a drug crisis where patients come in because they've been so
like a drug-induced
inebriated.
psychosis?
They've accidentally hurt themselves in the community setting because they were unable to. They were so inebriated they weren't able to look out for their self-interest, and they harmed themselves or they were harmed to someone else, and they were brought to the hospital for that reason.
So police officer recognized they were a threat, and under their criminal mandate, they have the ability to conduct a police officer hold
Correct. We used to do a lot more of those, which we don't see as much anymore. And that's what we see also, as well as the fallout in Portland on our streets, is many people are suffering, and we need to do a 72-hour hold. We need to be able to transfer them safely off the street when they're a harm to themselves or society. And we're seeing that everywhere now. And that's a breakdown in our system.
Very prevalent.
Yeah, it's unfortunate, actually. It's really, for me as a nurse, to see that breakdown. I look around and I look at Portland through a different lens, like a health disparity, a public health crisis, human suffering, and it really breaks my heart that our policies are we're just not there.
Yeah, we're not. And I like to, when I go out and when we do our nonprofit work, which you're part of because you're a consultant, right? You're working behind the scenes, helping us get those beds, right? What we call it is an urban refugee crisis, right?
Yep.
And in that situation, it's not really fair to treat people like they need to figure their entire life out, figure out the directions, everything they need to do, and then they need to go seek help. They need to go find the hospital and seek help. We really need to be out on the streets, right?
Yep. I have to say I'm passionate. This is one of my nursing things. This is what brought me back to getting my nursing license reinstated, is because of this public health crisis we see out there. I feel Portland could get back on track if we see this as a health crisis and get people connected to the proper services. We have to build it from the ground, the street back upwards, and it needs a nursing mindset, honestly. And so when I look at it, I see what systems are broken, and I know how to jump in. And so by September, hopefully I'll have my nursing license and I'll be fully out there full time. But in the interim, what I've been doing and volunteering my services is every time we intercept someone that is on the street exhibiting behaviors where they need a helping hand up, or they're in an area that they should be in, I look at each person individually with what needs they have and ask them the right questions humanely and with respect, but also recognizing, I think with my eyes, I'm able to see when someone's in a subacute situation that needs to be connected to services. We don't just leave someone there. And I think that's one of our strong suits is, right now, Portland is so sensitized, they will drive past someone in crisis and do nothing about it.
Walk right over someone.
Right over it, yeah.
Right over them.
And a part of our team, we don't do that. I don't do that. That's right. And that is why I am a consultant, and I see someone and I make sure they get connected, and I make sure anyone I'm supporting through Pacific Echelon or LOA understands that person absolutely needs to be connected, because if we don't, then they're just going to walk down the block and become a harm to someone else in society or to themselves. And I understand too the bigger services that have failed our community. And so we can make those connections. And I think that one of my strong suits is resource connecting and fundraising as well. It takes money to fill in this need. And what the real need is transportation. When you see someone, you absolutely have to get them transported to the service they need immediately.
Yeah.
Absolutely necessary. And
when someone needs help, they need help right then.
Right then and there. And so I think Portland in general, not just the state of Oregon, but Portland in general, has failed our community because they are ill-equipped with the transportation piece.
Well, no, it's not just
Portland.
It's not just Portland, it's the county.
Correct.
Because the county is essentially responsible for the majority of mental health. And that's usually that's a very standard model everywhere.
Actually, it's the city as well, too, because it's your police officer. Typically on your front lines, who's going to intercept someone in a mental health or a drug-induced crisis?
Now it's a police officer.
Yeah.
And that's a problem, though.
Yeah.
It shouldn't be.
I've seen them do a better job. They've really, really came a long way with lawsuits and education, de-escalation training, and they're pretty much hands-off now. And that is what we see in our society is the public is now stepping in to offset what typically our officers used to do. And that is, hey, you might need some help. You look like you're in crisis. Let me make a phone call or something. Or you don't even get that ability, and they just strike out because they've built themselves up so much that they're actually a threat now. And so our community needs to see the warning signs, and we need to make the calls. We need the connective services, but right now we're just out there.
Yeah, there's a complete disconnect between the individual who's suffering on the street,
Yeah.
they're being ready at a certain time and date, 100%, I want to change, I'm ready to change, and then getting them into an actual service. Right?
Correct.
That disconnect is, I mean, it's like 85, 90% of the time, it's almost impossible to get that individual into services. Would you agree?
I don't know numbers, but I know it's a challenge, and I like a challenge. And
Yeah,
you
you
know
do.
that
Yeah,
about me.
definitely,
I don't take no for an answer, and I will go the extra mile to make sure people can get connected, because I have a moral compass, and I think that's the nurse in me that is absolutely got to get that person connected. That person needs help. Can't just leave them there. But back to Alex's teams, Pacific Echelon and LOA, I think they serve such a great purpose right now, and in this time and place, because of our services are so broken. But just to back up a little bit, Portland used to do a good job with people who were compromised in our community settings. Like they had Hooper Detox, where we still have Hooper Detox, but they had a van.
It did go away for a little bit. Yeah.
Yeah, they had a van. And what happened was, if you were exhibiting certain behaviors in public where you were unable to help yourself, the van would pick you up, right? You were inebriated and whatever, and they would take you to Hooper Detox, help you sleep
I never
it
knew they
off.
had a van.
Yeah,
When I was in law enforcement, I took people to Hooper all the time.
I know this van. I've been
I did
in
not
Old
know
Town
they
a
had
long,
van.
long time, and I knew this van. And this is actually a system that worked back in the day. Hooper Detox van. The van would come up, pick up
Yeah,
someone
that's
in
what
the
that-
community.
yeah, that's what it should do.
You know, and take you to drunk
Wow.
tank. And then during COVID, that van went away. And I actually said I would make phone calls and say, we got to get this van back. And you know what? This van also started doing not just alcohol, but it started doing meth and drug overdoses. And they felt it was over their skis a little bit. And I totally agree with them, because the drug crisis is super dangerous.
Well, and this really began with Measure 110.
Yeah,
Right.
it all started during COVID and Measure 110.
So Measure 110 was a measure here in Oregon. It was voted on by the people. So it kind of bypassed the legislature. It was a majority vote, but that's what measures are here in Oregon. And then it essentially becomes law. And then the legislature and the governor have to figure out a way to turn it into code, to codify that into law. And so Measure 110 effectively decriminalized the personal possession of narcotics, right? And so with this, at what point are you allowed to legally then provide care to people who have the right to essentially use narcotics that can kill them, right?
It's crazy.
And on top of that, so in law enforcement, we have programs, kind of the slang for these programs are the golden handcuff programs. And this is where law enforcement and the criminal justice system, along with judges and also the prosecution, even the defense attorneys, they'll take an individual who was arrested, possibly on usually they're not person crimes. They could be property crimes and or drug crimes. And rather than getting prosecuted, doing jail time or possible prison, they would go into one of these golden handcuff programs that would allow them to get off of drugs, right? A detox program.
Yep.
And then usually it involved a little bit of community service, right?
Like
These programs have essentially gone away.
Yeah, actually, the Golden West is one of the programs,
That's
and I'm a super supporter of these programs because they work.
They actually have some of the highest effective rates, and this is nationwide. They have some of the best rates when it comes to lack of or less recidivism rates.
Correct. And these are the services that you saw decrease during COVID and Measure 110 because the public was bought into the idea that with Measure 110 we would have more treatment programs. And so, and I if you're cool with it, I could talk a little bit further about my struggle with, like right now, there's when it went into effect, we just didn't, you saw the community didn't get any results from it, right? No one called the number, no one went to treatment. And then when I started digging deeper in it as a consultant for Loving One Another in Pacific Echelon, one of the questions I get when we intercept someone is I look at them and say, oh gosh, do you need a moment where we might need you? You're now in a subacute crisis. You're not full acute crisis where I have to call 911, but you're a subacute because you're building up. Do I need to get you to Unity quickly? Or do I need to get you to an ER where medical professionals can stabilize you, give you that moment where you could, I say, rest? Because those people aren't getting rest, they're not resting out there. But what's happening is the treatment facilities, they're hard to come by. And I called Lifeline, and I was like, okay, if I was someone that was drug addicted, how hard would it be to get in?
Yeah.
And for me, actually, I'm filling out the paperwork for drug detoxes
All the time. You do this
all
every
the
day.
time. And I want to make the process.
What's the number one question they ask you?
Do they have health insurance?
Exactly. Do you have health insurance?
Yeah.
So recently we came across a subject who was a recent transfer from another region of America into Oregon. They had been here less than a month.
Correct.
And because they were from another state, they did not have health insurance.
They didn't have the Oregon Health Plan health share piece. And
Because they never signed up for it.
Correct.
Which, who's walking around signing up homeless people in the streets of Portland for healthcare?
we
Nobody.
help people.
Yeah.
That's usually the question I ask is, where are you from? Do you have an ID? And these are the pathways to getting connected services. Just an identification. Do you have health insurance? Health insurance is key to getting proper detox. Because
It's almost impossible to get detox without
correct.
it.
The only option for detox without health insurance is Hooper, and it's a lottery system, and it's already. I love Hooper. They do do great work. They only have a little bit of beds, but what they do is they take everybody. Think about that. If under Measure 110, if we don't provide detoxes that take everybody, then people can't get connected. So Hooper Detox is really your small shot, and then for Lifeline, the number you're supposed to call when the police officer gives you the card. I called those. Most of those drug detoxers are not even in Portland. So I did mention to Maxine Dexter, our House of Rep, I said, geez, if we're gonna push Lifeline or drug detox, then we should probably have services available to us in the Portland metro area and not have to, for us, we have to pay for transportation outside.
Yeah,
of
sometimes
the
we'll
Portland
pay $100 to $200 just to get someone to a detox center.
And just on a little side note, the reason why I brought up Hooper Detox's van is even if you gave someone a card to call the number, people that are in drug addicted, afflicted, who you see on our sidewalks everywhere, they don't have a vehicle and they don't have a way to get there.
They might not even have a phone.
Correct.
There's many times when we actually we'll get a prepaid phone and buy 2 or 3 months of minutes for the phone just so we can get in contact with that individual
Yes.
the following day so we can get them into detox.
Yeah, we have to make an appointment like, hey, come and meet us at this time. It's
Yeah,
kind of
'cause-
like back before we had cell phones, like,
Yeah.
hey, come and meet
Yeah,
me
right,
at the
yeah.
7-Eleven.
I'll meet you at the mall at
yeah.
3:45.
Exactly. So that's where we're at right now. But what our Portland's failing at is we don't have a way to get them connected so they can be transported to drug detox. Remember that Hooper Detox van that buzzes around the community that we no longer have? We actually need a drug detox van that
need
does
10 of
that.
them.
And so I'll get on my soapbox a bit about Portland's street response. You've got all those vans out there.
So
across.
explain. So a lot of the audience aren't going to be locals. So
Okay.
people are interested in Portland, but they don't know about Portland yet.
Yeah.
So Portland Street Response is a emergency services.
It's a response to 911
Yeah.
if someone is unsheltered, that instead of a police officer, they dispatch the Portland Street Response van. The model came out of Eugene,
There's social
Oregon.
workers,
Yeah.
maybe an EMT, something like
Yeah,
this.
and actually, so you call 911 and then you state what the emergency is, and you say, oh my gosh, there's someone who's unsheltered, who's naked on the side of the freeway, and
Or someone's yelling. I think
Yeah.
they might be in a mental health crisis.
exactly. And then the van shows up instead of a police officer. But the problem is that van is only providing water and some supplies.
They have soup in there, I think.
Soup or granola bars and stuff. They don't transport, and so they just leave the person right there.
Yeah.
And honestly, if you're calling 911 because you see someone suffering, what our community wants to see is that person connected to the services.
How many Portland Street Response or PSR units are there?
I haven't looked at the budget
4 or 5?
this year, but it's under the Fire Bureau under City of Portland, and they got a pretty hearty budget. And so
But each unit only takes around 3 to 4 calls a day. This is what I've been told.
The van, I think, is 8 to 5. Is it Monday through Friday? But what I expect of that van is to take the person off the street and get them actually connected. That could be drug detox. I'd like to say, hey.
Or there needs to be some level of
Yeah.
secure transport.
Yeah.
Another layer of transportation that's a secured and or also medical transport that can take individuals to hospitals or
Correct.
different areas.
This is what our public wants. They want to see Portland Street Response succeed. They want to see results. They don't want to see the person suffering every single day.
That's
and then
right.
they feel that the system is broken and they stop calling. And that's kind of where we're all at
That's
now.
right.
So, but back to detox. What I really
Explain how hard it is. So what time do you have to get into detox?
Well, first off, before detox, I consult with them, and I knew of detox, and most of our people that we were intercepting, I realized, oh my gosh, they actually need detox. Most of them need detox.
Almost everyone on the street,
And-
even if your main issue is mental health,
Yeah.
you're typically using to mask that mental health issue.
What I'm kind of excited about with working with Alex's two teams is the fact that we get intercept people when they're ready to go.
Yeah.
Oh my gosh, it can't get any better than that. When we see them in their most vulnerable moment, and they reach out, and we reach out our hands and said, "Let's go, let's make this happen." And I think the first couple times we did a drug detox transfer, to me it was euphoric, because this is what Portland wants.
Yeah.
They want to see. They don't want to see drug addicted people out there in the sun or in extreme conditions.
Yeah.
So it does take a while to get connected because of the insurance piece. Usually, what I have to do is I immediately see them, I collect their information, I hurry and make a quick call.
So let's say this is on a
Yeah.
Monday. They come up to us at 3 p.m. and I'm like, you know what? I'm done.
Yeah.
I want to get into detox. This happened to us on July 4th,
It always happens.
which is a
It's-
holiday that no one's open.
Yes, and actually, I swear that detox is always Friday at 3:00, and
it
I
is.
feverishly
Yeah.
work like around the clock and make phone calls. I think last Friday, for example, I had someone that wanted to go to detox Friday at 3, and I thought I made about 20 phone calls, and but I know all the right information to ask, but it's just such legwork to get that person in, because in order to do detox, you have to find out exactly what drugs are in their system,
Yep.
because that factors in their treatment time. So
It also factors in how much money that treatment center is going to get paid.
totally.
So if
Yeah.
it's fentanyl, there's more federal dollars
Correct.
and local dollars that will pay
Yeah.
usually 3 to 5 times more to detox someone off fentanyl than off cocaine.
I was actually blown away when I started learning about the detox process. Yes, if fentanyl's on board, yes. If it's just meth, they may not take them.
They may not take you for meth.
Yeah, and so
Because they're only going to get paid $100 versus $800.
so I usually have to look at what I do is I kind of throw a line out there to all the detox centers to see who actually has an available bed, who's willing to take them with their insurance.
I like
and
how
then
you're
what-
fishing. I love it. You got to
It's
get one on the
always
line.
it's always like that. And then, and also to what drugs are in their system.
Mm-hmm.
And then if there's any psych issues that are attached to that as well. And I usually say to the detox, I've got someone that I think that isn't have a severe psychiatric situation, but also it has this, and they've only, and I also dig deeper into the person also respectively and say, have you done this before? Were you successful? And also letting them know too that I think when they come to us for detox, they're so low. They're like so low. And the one thing that they know is when they're reaching out for detox is with us is we care about them. We do. We really do. We're going to make this happen. Yeah, but detox for meth is about 3. Don't quote me because it depends on each treatment facility and what medications they use to help them come down. But typically, roughly, meth is 3 days. With fentanyl, it's 4 days. If there's more comorbidities and drugs on board, it's 5 days plus. And then it depends on what treatment plan.
So let's dial it in, right? Let's dial it in. So getting someone to the detox, especially even at Hooper, which again, great facility. You have to be there at like 7:30 in the morning.
Yeah.
And typically you have to have all your paperwork done the day before that. So let's say there's a houseless individual, right? And for HIPAA reasons, she's an RN. She's doing a lot of that back end work. We don't talk about names when she's involved in this, right? Because of her background in medical world. So we have a houseless individual. They contact us on a Monday, 3 p.m. We're scrambling to get paperwork done because not only do we have to get the paperwork done for the detox facility? But almost always they require a bed to be attached to that individual before they get into detox. So we're also finding them a shelter bed, and we don't know if it's going to be 3, 4, or 5 days later because we don't know how long it's going to take them to actually detox and stabilize. So we're doing 2 sets of paperwork.
Correct.
I mean, and by we,
kind
I
of
mean
3
you.
actually.
Oh, okay.
There's
so
the pre,
that.
the mid, and the post in terms of detox, because for us, when we intercept someone, they're actually in a tent or on the ground in a compromised situation. Their safety is now breached. Their health condition has worsened.
That's right.
We need to find them immediately.
They're stepping away from their drug dealer, that could get violent.
Yeah.
They're stepping away from a relationship that could turn violent.
Correct. Yep. And that's, it reminds me of I had a prostitute who, this is a great example. She
A sex worker.
is that better?
I would say a commercially sexualized.
Perfect.
Commercially sexually exploited person.
I care about everyone. She came up to me. She was found in a parking garage in downtown Portland, and she was living in, what happens is they hop from tent to tent because, and in the guise of being safe by a male or something, or someone that could provide them some kind of safety. And she reached out to me. I got a tip that she wasn't looking so good on the street. She felt very insecure. I spoke to her in confidence, and she said, I'm scared for my life, and I don't think that I got caught up in this drug thing, and it's taken me over, and I want to get my life back on track, and I'm scared. And she was hiding in a parking structure, and I said, you know what? We got a game plan now. And so I put her in an emergency shelter.
So she's hiding from her pimp.
Pretty much, yes.
And
what I originally started was, well, would you, I don't like to give tents up because I think that tents are not the way to go for Portland. I think services are better. Yeah. So what I said to her, because that's what she was used to, right? A tent. And she asked for a tent. And I said, I'm going to take it a step further. I'm going to put you in Gresham Women's Shelter. I would like to give a little shout out to Gresham Women's Shelter.
And I don't even know the story.
Yeah.
We save so many people.
Yeah.
There's so many stories I haven't even heard. I haven't heard the
so
story.
because she was, I think it was like a Friday night or a Saturday morning, I can't remember, but I remember it was off hours, and I remember having to struggle, and I cared about her, and I was like, I'm not going to leave her out here in a parking structure, fearing for her life. And I have to give a special kudos to Gresham Women's Shelter. They do such a good job. Portland is struggling with women's shelters right now, and that is the only workhorse out there. And I call the mayor's office, I call the county, and I say, you have to do a better job of women's shelters. That's the one service that we are short in Portland.
About 10 years ago, only 5% of the population of the unhoused were women. Currently in Portland, it's 20%.
I blame the drug crisis 20%. For that as well, because they get into the lifestyle, and then they become compromised, and they become victims of the game, right? Fentanyl is absolutely a victim creator. And actually, it creates a victim for all people, all humans out there that are caught up in this drug situation. But anyway, back to her. I got her emergency sheltering, and I said to her, you absolutely, this is a stepping stone. I care about you. We're going to respect each other. And if you follow me, we'll succeed. And I said, I need you to go to drug detox. And so we talked about it, and we talked about the different options. And she was savvy enough to know, because she's tried it before, and she didn't want to suffer. And what's interesting to me is people in the street, they know that detox can be painful. And so for someone like myself, I have to understand the process before I offer it to them. I can't just, well, you're just going to go to Hooper. Well, Hooper makes you bite on a stick, because Hooper doesn't allow you to come down easy, right? Because they are what they are. You're just straight up detox. Fora and the other services out there provide a little bit more of an easy transition down. And so for someone like myself, that's reassuring to that person on the street that might have tried drug detox before and they're vulnerable. I was like, let's work here. I'm not just going to give you one option. I do love Hooper Detox, but like I said, they are good at what they do, but there's other services that make it a little bit more of a gentle process, and they're scared of suffering. They are.
And so this individual, you were able to transition them successfully? To
Fora, yeah, wow. Because they were worried, and they would only take Fora. So Fora has a...
So they went to Gresham's Women's Center.
Yeah.
And then from there to Fora.
Fora. But so think about all the things I have to do. Finding and intercepting someone on the street, gaining their trust, figuring out, like, from a health-related standpoint, what they need to succeed, not forcing something on them, but finding the right treatment path for her, right? She, as a nurse, it was like, not yet, but my former training was, safety first.
Yeah.
I got to get this woman off the street right now. Number 2, then we can focus on detox. Number 3 is long-term housing. And I check in with her, and now she is eligible for being placed on lists for affordable housing or something like that, transition
Amazing.
out. But I have to check on her too. And then, her case is just like everybody else. The people out there need that customized case management, and they're not getting that right
It has to be customized because each individual is unique.
Correct. I can't just send someone, it just depends on their social structure too, whether they're going to succeed or not. And in this case of this person that was a sex worker, she actually had people in the community that were not a part of the drug trade that cared about her. And so we were able to link up with that person, because I'm not going to be their social support. I'm a connector. And so I want to make sure that they have someone on the outside. And I think
like a faith group or a family.
Correct.
Family,
yep. Get them and for example, our last case,
maybe AA group.
I had
NA
that
group.
gentleman that came from out of state. He didn't have a social support here.
0.
And so I had to look at him a little different. He's not a hooper.
No health care.
No health care, and he's
No
not a
family,
hooper.
no friends.
Yeah, and so I had to find some, and he was scared of the come down, right? And so, and he
got sent here actually from another state. They just put him on a bus and said, "You're going to Portland."
Correct. Yeah. And by the way, I work with TPI and all the agencies as a consultant. I respect their rules. So we don't send people back to their state in a compromised condition. So I looked at, because he wants to go back home, right? A lot of people do. When they get here, they believe this Portland was going to give them some kind of like experience that they were sold via on media, maybe social media.
Yeah, urban camping, all the drugs you want.
Yeah,
right?
And then they get here, and then they realize pretty quickly that
A
Portland
Bacchanalian
victimizes
festival,
you.
like the Burning Man or something, right?
Something. No, and actually every day I deal with someone that's from out of state. They arrived here and they no longer feel safe. They don't have social supports, and so I actually, being a consultant, I also work with Union Gospel Mission to do the Ticket Home program. But they do such a good job of making sure we find that they have a social support back home, and we get them.
We want to contact a family member, screen them, make sure that they have a place to stay, and actually
it's
a
the right
support
move.
system.
Yeah. And
because we're not just going to funnel homeless people randomly across America.
And we're definitely not going to send someone with an active drug addiction back and pass the buck. I think that we do a good job of at least making sure they're connected to services. But back to drug detox, there was what I was explaining about the part was getting the person safely connected to a shelter. We do that for anybody. We get them a temporary placement, and if I can't get them a temporary placement, I ask them where they can temporarily be safe, where they're safe. We also give out vouchers for shelters too.
City team is great.
And sometimes they'll say to me, "Well, I don't necessarily want the shelter." I'm like, "This is going to be for 24 hours until we go into drug detox. This is a step up out of the situation
Sometimes
that you're in."
we use a hotel room.
Correct.
We do what we have to do.
Correct. And then they go into detox for about 3 to 5 days, and then I circle back and I make the connection where if they get released, we go ahead and arrange their public transportation, secured transportation to a residential treatment program that can totally support them because they're vulnerable. Right? We wouldn't want someone that just got freshly detoxed back out on the street where they might see the circumstances that put them in there in the first place.
So to say it briefly, it's very complicated.
It is. It's so complicated. But it's happening. We're doing it.
It's complicated.
And if we can do it, our city can do it.
If we had 100 people doing this, I had the stats here. Usually I don't use this, my memo pad, but last month alone, just loving one another, which is 3 full-time people and 1 part-time person, right? We sheltered 141 people. We bridged 7 people in hotels. We reconnected 11 with family members. We got 11 into housing. A lot of those are the RV park or also the tiny home, right? Some type of housing. We got 5 into detox and 1 into unity. Right? So that's a total of 176 people that literally 3.5 people did, right? And you facilitated the majority of those.
That's my favorite piece, is the success, is making sure. I love complicated cases. I want to make sure people get connected. And actually not on that list are referrals to aging disability services. I did 2 in the last 45 days where someone I saw out there exhibited behaviors where they are unable to handle themselves in the community. And I put in a consult with the county to get them services that they deserve. Like recently we had an unsheltered male that lost his eyesight and was getting attacked and beat up. And I called Aging Disability Services and I said, okay, I think it's time. And so oftentimes a lot of these cases, the feedback we get from nonprofits and hospitals is like, thank gosh someone's doing the job.
Yeah.
Can't believe you're doing this.
You're actually out there doing direct service?
Yeah.
And we're like, yeah.
Yeah.
And they're like, no one does that.
No. And we usually get, what's interesting is we get calls like from the hospital. I got a call from the hospital the other day and they're like, Tiffany, we need help with this person. And I thought, oh my God, we're finally there. We're finally there. Yeah. People trust us in the community. Yeah. The unsheltered trusts us and our where the service providers we're connecting to realize that we're serious about what we do.
Yeah. So I just on air, I just want to thank you for all the hard work that you do, because these 176 people, they matter.
They do.
And, sometimes I think that we forget that all these people, they were someone's father or mother, they're someone's brother or sister. And I've lost my brother. And I would do anything, almost anything, to get my brother back, if I could just get him back.
Yep. I think
these people they're all on death's throes. They're literally standing at the precipice of the end of their life, about to fall into an endless pit. Well, they'll never be seen ever again. And we, specifically you and the street crew, you stepped up and you saved these 176 lives.
We made the connection.
You made those connections. And that ripple effect in a community is going to affect tens of thousands of people, their friends, their family members.
I have a strong moral compass, and when I see this, I want these connections. This is what our community wants. We're a connector. I am a connector.
Yeah. You're the glue that holds it together, too.
Well, I mean,
if
everybody made actual connections, I think Portland would be better off. Yeah. But here's the deal. I do hold a lot of these places accountable. Our shelter systems right now in Portland, the county and the city shelters, I'm proud of them because they take anybody and everybody. You can have a drug addiction. You can have warrants. You can have a pet.
If they have a bed.
If they have a bed, and most of the time I can get people placed. It's just it may take a few days, and if I can't, then I go to the other counties around us because you know what, they should be a part of it as well, right? They can't just send people to Portland and expect Portland to deal with it. But back to them, I look at the shelter systems right now. They're getting all these folks that actually need drug addiction services, and I hold accountable. I won't tell you how many times I talk to a shelter operator or their caseworker and say, "Hey, why did you send this person back out in the community? You knew they needed XYZ service."
What do they say?
Exactly. I think
we needed the bed. We got more funding. This person was on fentanyl.
Or, you know what, Tiffany, you're right. We should have probably done that. Ooh. Or oopsie daisy, or stuff like that. I mean, we're all humans, but as a Portland taxpayer or someone in the community, we want to see people actually connected to services. So I say, hold our shelter system, our county and the city, both of them, accountable. When a shelter takes on someone that has an active drug addiction, you should probably ask to see how many drug detox processes they do. Currently, I don't see them processing anyone to the drug detox center.
It's very rare.
Yeah. So if we're, I was talking to, I won't say which drug detox facility, but we send them so many. They're like, where are you getting these people? And I said, are you joking? Look around you. Everywhere I look, someone's in Portland. A drug crisis.
They're from Portland.
And if you're questioning where I'm finding all these people, I'm finding these people because they're in the wrong place at the right time, and they're intercepting a team that cares about them and making the connection.
We've been told many times, you're currently referring more people than law enforcement.
Yes.
The county.
Yes.
The actual agencies that have the millions and millions of dollars to do this, and we're doing this with 3.5 people.
And the community knows it too. So, what's funny is I bet you if the county or the city put out a billboard on the side that said, call this number if you need a ride to drug detox, they might actually get people to go, or a location that says, go here on the billboard.
And there was a bus
Yeah, that
there
will
was a
come
bus
get you.
that just took you, and it just ran 24 hours a day to
Yeah.
detox centers. That's
Or
actually
like
a great
a
idea.
caseworker. Like you'll get appointed a caseworker.
The
that can
caseworker
help
should
you.
be on the bus waiting. They should be part of the busing system. They should be in the
Yeah.
bus triaging.
Well, by the way, if that's the case, then we need federal dollars because right now with this drug crisis, we're attracting everybody across the nation to be here because of the legalized personal amounts of all forms of drugs. I'm going to tell you right now, and I tell the person
No,
on
I'm
the
going
street.
to tell you right now.
I'm mad. I do harm reduction as well.
This is Tiffany mad.
And originally during COVID, I was okay with giving out Narcans because I thought it was the right thing to do because of social distancing, spacing, and our healthcare system was overwhelmed. But we're post that, and what we're seeing is people are dying so much that I cannot be behind a policy that is a death sentence, really. Every time we go to use a Narcan, it could be up to $500 because you have to administer one every 2 to 3 minutes.
And what is this called? Harm reduction? Or
Correct. And now it needs to be harm prevention or harm. Instead of giving them the tools to kill themselves, we need transportation instead.
So the public policy terminology is harm reduction, meaning, well, we should give them safe needles to use to inject the drugs, or we should give them foil and straws. So we know those foil and straws are clean and they don't have to share them so they don't get COVID.
Correct.
So we're reducing harm on the streets when really you're actually facilitating drug deals.
So one of the problems I have is once someone overdoses on the street, they're blue, and you have to recess them back to life, and then use $500 worth of Narcan. To me, that should be an indicator that person needs to be considered for drug detox because the chance of them coding again is so much higher, and that's a drain on our system. And our 911, as you can see, can't handle that. And it's crazy how many
So
times.
isn't addiction considered a disease? No?
I don't know how to define that.
Since the 80s or 90s? I'm going to get an expert on because my whole thing, as a former Leo, and that's not a sign on an astrological chart, that means law enforcement officer, right? As a former law enforcement agent, I look at the police officer role, the ability to do a civil commitment, right? Yeah. And it seems that if someone is struggling from a drug-induced psychosis or their addiction is so harming that they're overdosing, that you should be allowed to do a police officer hold for that reason because addiction is considered a disease at this point. So that is a disease. At some point we need these civil commitment laws to change with our society and what's really going on.
I wish I had time to ponder those thoughts. I'm more of your frontline nurse soldier, but
True story.
It's
That's
true.
a command decision.
I'm all about. I was trained ER, and I'm like, I don't have time for that. All I know is I got a problem on the street, and I need to get them connected.
You have 3 rooms, and you have code in 3 rooms.
Yeah, that's I don't take time to ponder about that. But
Tiffany Hammer.
Yeah, yes.
Tiffany Hammer, you're fantastic. You're amazing. We could talk for hours about this. But where I want to go now is, I want you to talk about the past because you're a property owner, in downtown area. I want you to talk about the past, the present, and what you think the future is going to look like.
Yes. Okay.
So talk about kind of how we met and where Portland was, how the gauntlet that we traveled through, and where we want to take Portland.
Okay. So about 3 years ago, you and I met. I am a property owner in downtown, also a former registered nurse, community health nurse. This is where I went to school. Mm-hmm. This is my community, and I love my community. And when my community's not feeling very well, obviously I'll have to step in. So what I stepped in 3 years ago was in public safety roles. I was the president of Public Safety Action Coalition. I also serve on the Clean and Safe Board as a representative for property in Old Town, but also I serve on a subcommittee for behavioral health. And so one of my biggest pushes early on.
So you sit on a lot of influential committees and boards.
And I definitely lean in on behavioral health issues, public safety health issues. And I'm very passionate about that because I think that's the direction Portland needs to go.
Yeah.
Yeah.
And mental health, 100%.
Yep. And so 3 years ago, being part of downtown, I call it the essential involvement. I couldn't zoom away, get away, and I was there every single day to watch the whole fallout.
So everyone else is hiding in their homes or not showing up to work, and here we are.
Yeah, I was there from the beginning. And if
we're walking the streets, we're like, hey, this is getting worse. And everyone's like, no, it's not, it's fine. But those people are on Zoom.
Correct.
Miles away.
So what I did as a part of my community, when I saw suffering, I saw couple things. I saw the drug crisis take hold. I saw COVID.
People weren't overdosing.
No, they weren't.
I mean,
this is
very rare.
No, and I don't know the stats, but I know it was not. I mean, it was more rare. And back then, our police presence in downtown, Old Town specifically, pulled out. We used to have a walking foot patrol, and at that time there was a staffing shortage. There was a lot of political unrest, and when the walking foot patrol pulled out, what I saw was an explosion of health disparities, human suffering, victimization, drug overdoses, everything you can think of under the sun, and so I stepped in immediately. I saw people living in impoverished conditions because our typical structure, our laws, everything just went out the door. And you saw people living in actually inhumane conditions. And then somehow we evolved into, I guess it's okay having someone living on the side of the street or the road, urinating, defecating right there where they're laying in it, and that's acceptable.
Yeah, in fact, there were, I think I can remember at least 3 deaths that were the result of, it was wintertime. These individuals had winterized equipment, but they were robbed of it in the middle of the night and actually died from exposure or hypothermia.
Yes, and
so the gangs were actually going out and robbing people's tents and sleeping bags in the middle of the night it's like 20 degrees outside and raining.
Early on, and people will tell you, and the city knows, the city of Portland knows, I started tent counts as early as March of 2020 because I was down there and I started to see an influx of people coming into the inner core.
And the tent count is, people living in tents on the street.
Correct.
And sidewalks.
Yeah, and I did it by geographic locations because I felt it was the best indicator of our success or not, and how much impact it would have on a neighborhood. So what I did is I started with Old Town, Chinatown. I did the monthly counts, and I actually still have all the data for all those years, and I still keep up with the data because to me, if Portland has to have some kind of data to follow, are we really helping people get connected to services if our tent counts go up? If they go down, then we know that Portland Street Response is a success. And so that's kind of where I look for benchmarks. And I do it for other areas too that I care about greatly. So if you have me in your neighborhood, then you know that I care about your neighborhood. And chances are you probably have a tent count on your neighborhood.
That's right.
And so the inner core area, and you'll see me I did a news interview a couple years back. I actually would keep the tent counts with downtown. I worked with Pearl District, Northwest District, and Goose Hollow and Southwest Hills, and collectively we understood who was coming to us in this inner core area during this crisis, and then I gave it to the mayor's office after that. And to me, I think actual real-time tent counts in neighborhoods are more effective than I don't mind the 1-year count that the county does, but the problem is when they go to announce it, people up and rise and leave, and our neighborhoods are what really sees what in real time what happens. And so if we one of the issues for Portland is if we want to tackle this, we have to do it by geographic locations. We have to really look at community health. And that's why I think a community health nurse would succeed in this environment, is because system-wise, when I look at Old Town, I know that population. I have their tent counts. I know how to get them connected to the services. And then when I go to another area where you're working and we get people over there, I have to look at why they're there, what they need, what other services they have. And so Portland, I think in the future for Portland's success is we have to work on more transportation to get
Transportation is absolutely key.
Yep. But also too is more services that are equitable across Portland. I'm so sick and tired of them putting every service in Old Town right now. And that's actually what's creating more victims in marginalized conditions. And history is repeating itself when we do that. right? It's called I'm all about decentralizing services. They have to be equitable across Portland.
Well, and typically, these services are put in minority neighborhoods.
Correct.
And it's kind of an old form of redlining.
It's really not good.
Where you're intentionally driving down values, you're keeping minority neighborhoods from real success.
And actually during COVID and post-COVID, we noticed that homicide was, because of what we did, as like, oh, all the services are over here, and then and if we had a large concentration, what happened was homicides spiked up and victimization, and so that model does not work.
Yeah, if you put all the resources in one area, and then 500 people move in
It's
to
like
a
Hunger Games.
to a 30 yeah, it's like Hunger to a 30 block area.
Yeah.
And now you have to fight over blocks, and you have to pay money or drugs or sex for protection.
Correct.
You got all this social dynamics.
Street wars.
Because you're forcing everyone into one area rather than having a decentralized platform.
I've seen this many a times, and I go way
so
back.
they're
even
causing
over 3 hours.
drug and gang wars.
Correct. And so,
That
for example, when the
decentralized system.
county announced they had extra funding to House People Now program, they came over to Old Town, which is already marginalized, which already has services to get people connected right there at TPI, showing that they were guiding people from different facets of Portland to an area that they might not necessarily hang out during the day in. And then we started seeing a little bit of skirmishes and stuff, and people felt unsafe. And even people said, I'm too scared to go over there. And so to me, that was guiding people into an area where it was already burdened.
It was so bad, that Greyhound had to shut their entire facility down.
They did this.
And to make money, they rented it back to the county.
Correct.
Right? And so now the Greyhound, which used to be a station, which caused increased levels of engagement, right? Which would naturally bring crime down with community engagement going up. Now it's a shelter, and outside the shelter are all the drug dealers in the tents selling to the people in the shelter.
Now, Portland, if they want to get on track, we shouldn't have TPI over in Old Town as the only place to go get all connected services. Portland needs to have at least 4 geographic locations, North Portland, Northeast, Southeast, because all communities have homeless people.
That's right.
But forcing them to go to one and only location, if they come all the way over and they get victimized while they're in the line.
That's the problem.
Yeah, that's a problem. And you're most heavily drug addicted. By the way,
about 15% of the homeless population are transitory homelessness.
Right.
You have the typical mother with 1 or 2 kids who was victimized by a domestic partner. And so they're out in probably Gresham, somewhere else, which is a safer area to be. But in order for them to transition, they have to drive into an area that is riddled with gang violence and shootings in order to get service. And that doesn't make any sense, because why would you want to bring a 5-year-old and a 7-year-old downtown and make them wait in a line where there are drug dealers across the street selling dope?
Correct. Right. Now, I have to give a special shout out to Old Town, because I'm a part of Old Town. Our community has had enough. We've already done our share. Portland needs to do the rest. We are so accepting of
Portland and the county.
Yes, Portland and the county. That neighborhood alone takes everyone. No judgment, right?
That's right.
But you have to also recognize that this area is now struggling, right? Homicides up. It's not up right now, but now what it is drug overdoses are up. Why would we guide people from all over Portland to an area where drug overdoses? I mean, right now, a couple times a day. Yesterday, I parked my car for a split second, and someone was overdosing, and the stretcher was out there on the sidewalk, and I thought, oh my gosh, Old Town. So we shouldn't guide people to an area that's struggling. We should set up equitable areas.
So that's what the future looks like. Tiffany, you're going to continue to be a part of the family. You're going to always be in the back, as that central nervous system, helping the body function correctly.
Always.
Right?
I support your staff behind the scenes. If anything, I support whoever intercepts the person to provide them the services they truly deserve and need. And you've got a great team.
Thanks. If you want to check out the work that we do at Loving One Another, it's loapdx.org, loapdx.org. Tiffany Hammer is not listed on the website because she flies under the radar and behind the scenes.
Yes.
That's Tiffany. That's how she rolls. It was actually extremely difficult to convince her to come in today.
Yeah.
She's a bright, shining star, but she would prefer not to get any credit. She would love to push that credit onto the frontline workers, the street crew.
Correct.
And I appreciate you coming in today, Tiff.
Yeah.
I know we're going to hit the streets because we don't sit in Zoom meetings.
No.
And we don't want to work in an office.
No, actually, Alex asked me
Right.
to do this, and I said, no, you've pegged me right, but I'd rather spend that time working on the streets because
Yeah.
I know that time is of the essence and we need to help people. So
That's right. Someone's overdosing right
yeah,
now.
I'd rather not do a podcast. I'd rather be out there helping
Yeah.
people.
So but it is important to get the message out, but we're going to go hit the streets and we're going to actually work towards the benefit of other people because that's what Loa's about. That's what Tiffany's about. So I say we go hit the streets. What do you think?
Let's do it.
All right, let's go.
Okay, thanks.